So when you do have hip pain, it's good to think about, when to go see somebody. It's always a question. It depends a lot on how it came on, the age of the patient. So if something comes on very acutely and seems more severe, it's something that you want to at least touch base with your primary care physician, or potentially go to an ER if there's an acute injury with a lot of swelling and bruising and difficulty bearing weight. But there's things that we do watch for, especially in younger kids who have a limp and have difficulty walking and maybe have other related symptoms like fevers, that we really want to be evaluated as soon as possible, just so we make sure that we don't miss anything bad.
A workup for hip pain when you come in to be seen usually starts with a good, thorough history. We're looking for signs of problems prior to this incident, a history of the same, how long the pain's been going on for, etc. Things that make it feel better, things that make it feel worse. And then after that, we have to continue the workup to do a physical exam, see what might be going on, what might lead us to a better diagnosis of, or better understanding rather, of what might be going on. Occasionally, not always, but occasionally it does require additional imaging, such as radiographs or x-rays. And beyond that, sometimes we need to use other modalities, we would say, such as ultrasound, MRIs, or CAT scans.
Sports ultrasound is used a lot now to diagnose hip pain. It's a big component of our sort of multidisciplinary team that we have here at Children's. We often will do what's called a dynamic hip ultrasound evaluation, where we'll first do a static exam or a stationary exam just to look at certain muscles and tendons, look at the structure of the hip joint itself, look at the labrum itself, and then what we will do is put the hip into different positions while we're performing the ultrasound and see how the hip moves. Does it impinge? Does it cause any soft tissues to get impinged in certain positions? Does the femoral head move or translate in different ways when we put the hip in different positions? And with that, and then some of our other imaging modalities, we can put it together and decide what the best treatment option would be for that patient.